Whether you call it the Baker Act, a 302, or a 5150 hold, patients who are being treated for behavioral health emergencies are an increasingly large segment of the patients we see in EMS. However, just because a patient is under some sort of voluntary or involuntary behavioral health hold does not automatically mean that patient meets the requirements of medical necessity for ambulance transport. This is true even if the patient is being transported from a hospital to a secondary inpatient behavioral health treatment center. As a quick refresher, Medicare covers ambulance services only if they are furnished to a patient whose medical condition is such that other means of transportation are contraindicated. While the definition of medical necessity may vary between payers, the basic principles are the same. Remember, when it comes to medical necessity, documentation matters. You should document specific facts about your patient. Was the patient an active danger to themselves or others? Did the patient require some type of restraint, whether physical or chemical, during transport? Was there another reason that the patient required ambulance transport, like IVs, bed confinement status, or special handling requirements? Also, be careful when documenting that the patient required ambulance transport because they were a danger to themselves or others. While the patient may have been a danger to themselves or others at one point, that may not be true when you arrive to transport the patient. Take, for example, a patient who was threatening suicide, then taken by police to the nearest hospital for treatment. After being cooperative and calm for the last 8 hours, the patient now needs to be transported to a secondary inpatient behavioral health facility. The patient is pleasant and agreeable upon your arrival. During transport, the patient has normal conversation and even sleeps a bit. It would be a stretch to document that the patient is a danger to themselves or others in their current state at the time of transport, even though it may have been true hours earlier. Bottom line, like any other transport, you should thoroughly document behavioral health transports and not simply rely on the fact that the patient is under a behavioral health hold to justify medical necessity. Thanks for watching.